So here we go. We are live, and I'm Gustavo Tolosa. I'm here with Dr. McDougall. I am actually in San Francisco, California, getting ready to go tomorrow to Santa Rosa and be at the 10-day program. I'm super excited to be there again. And I just want to welcome Dr. McDougall. How are you doing, Dr.
Well,
McDougall?
I'm good, Gustavo, and I'm glad you're in San Francisco. Thank goodness you're close to us. And yeah, we'll get together tomorrow. Let's see, tomorrow we start a program. Boy, we have so many people. Oh, but
I know.
only the right number. we actually, I think, had to cut it off 2 months ago. So we got the right number of really wonderful people coming tomorrow, and we look forward to seeing you. And by the way, as we get started, folks who are listening to the webinar, don't complain about the noise in the background. Gustavo's in a very fancy hotel, a very fancy restaurant in San Francisco, and dedicating his time and effort to making sure that we can all get together today. So it's not ideal. Next week you'll be here in Santa Rosa. We'll find some great place to do it. Maybe we'll go to Charles Schultz's museum and do it with peanuts or something. Or with Luther Burbank. We'll do it at the Luther Burbank Center. Santa Rosa, very, very famous.
Yes.
Famous place that you're going to be visiting today.
Do you know, Dr. McDougall, I was thinking today that it's exactly 4 years ago that I attended the August 10-day program. And I'm doing it now in August, 4 years.
Wow, isn't that amazing?
And it's amazing because it changed my life. And I want to let everybody know that 4 years later, I can still follow the program. I still love the food. I still have kept all the weight off and continue to lose. And anybody can do this. Thank you, Dr. McDougall, for doing that.
People come up to me all the time, Gustavo, and I love to say this because it's really true. People come up to me and they say, when I'm at lectures or even walking down the street sometimes, and they'll say, I know you're tired of hearing this. And I say to them, no, I'm not. I love to hear that we've helped people, and I'm glad we helped you too. You don't have your before picture with you, do you?
I don't. I think it would take a while to find it, but I'll have it next time.
Anytime. But what I want to point out, I really want to talk about San Francisco today, but what I wanted to point out was here you are 4 years later, eating, quote, the diet, loving the food, quote, the food, not suffering, still on the program. And I mean, these are the most important things, is that you like what you're doing. And that's what everybody out there that's listening that knows this already, or those of you who don't, those of you who are trying to share, whatever the situation is, you got to start out by telling people this is not a deprivation program. We're not asking you to give up anything you like. You really don't enjoy the taste of it. And we've been into that, how you have to cover up chicken to eat it. You have to cover it with barbecue sauce. I mean, we're not really making that kind of change, but you're suffering. So anyway, I wish there was a pill that I could give you, and then Gustavo and I, what will we be doing today? Probably the same. Probably wishing we were doing what we're doing today. No, there's no pill, folks. Unfortunately, the problem is food poisoning. And what you need to do is fix it. And actually, this month's newsletter, Gustavo, I'm writing about frequent questions people have for me. So if you can think of questions, well, you, Gustavo, I guess we'll just have to, you and I talk about questions that people always ask you, like, I'm following the diet and my blood sugar is too high. What should I do? And, I don't like the food, and I'm losing too much weight, and my blood pressure is too high, and I can't get off my medication, and I'm scared of my doctor. I can't talk to him or her about the fact that I want to be healthy instead of just drugged. Yeah, that's what I'm writing the newsletter on about this month.
That is a great idea.
Just maybe 2 or 3 sentence answers to you,
right?
Which I would give you anyways if you emailed. You said, like somebody did today, I've been on the diet. Like they've been on the diet. Then they tell me 80% of the time for like 6 days. You know, they put those little caveats in there. But I've been on the diet and my blood sugar is still scarily high. You know, what should I do? Well, you know, what should you do? Well, I give the same answer pretty much every time. That is, you need to be under medical care if you're sick and adjusting medications. But you can't expect the program to work in 72 hours. It does, you know, sometimes lots of things are fixed in 72 hours, but you can't solve 4 or 5 decades of abuse in just a few days. And you can't follow the diet 80% because you're lying to yourself and to me. And, you know, that was a question I got this morning. I didn't say that untactfully. I can't, you know, I said, you really have to stay on the diet longer and more strictly to see if you can't get the results you're looking for. And you know, there's certain pat answers that I offer people. I'm losing too much weight. What should I do? Well, you eat more nuts, seeds, avocados. So this month's newsletter is going to address those kinds of things, and so that you, Gustavo, can say, well, read Dr. McDougall's August 2017 newsletter, or Carol, who gets your phone calls all the time when you sign up for the 10-day program, which starts tomorrow. We have another one coming up late fall. Or the intensive weekend, which we have coming up September, I don't know, what, September 8, 10, something like that. The intensive weekend, which is the least expensive, most intensive personal education you could ever get from our staff, our personal staff, Jeff Novick, Doug Lyle, Mary McDougall, myself. Our personal staff we're there the weekend, which is coming up here in 2 or 3 or 4 weeks, sometime in September. And you get to taste some of our favorite foods. Our resort serves our favorite foods at this event. And like I say, this is it's all free on the website. I have not held anything back. The books are clear. But you know, that personal touch, that extra education and contact that you can have not only with us, our staff, our resort, our food, but the people around you, those who have been great successes and those who are struggling, can't be compensated by a book or a website. It sometimes needs, it actually can't be replaced by a personal experience like the September weekend. Anyway, Gustavo, what I wanted to do as we're getting started is I wanted to talk about what you're doing. I mean, I know what you're doing starting tomorrow, but what you're doing today, you went to San Francisco yesterday, and you're fighting for your life today trying to find food. So how do you find food in San Francisco? Let me just use San Francisco as an example because we live 60 miles from the bridge. And we are in San Francisco on occasion, usually traveling through, but sometimes it's an invitation for dinner or some other event. And so I know San Francisco a little bit, and what I say applies to every big city I've been to. But let's just talk about San Francisco. San Francisco, when you come to San Francisco, you do not want to find a vegan restaurant or vegetarian restaurant. There's one I can think of that starts with the name of a color. Not going to mention it, but it starts with the name of a color. There used to be one. It was owned by our friends, close friends of ours. It was based upon a time period. I'm not going to tell you the name of that one either. There are a few others in San Francisco that are vegan restaurants. I can't eat at them. And the reason I can't eat at them is because they try and mimic the American food. At one of these restaurants in San Francisco, when I go to it, which is not often, I look at the Mexican place across the street and I go, my goodness, instead of spending $100 here for 1 or 2 meals, I go across the street and get a burrito for like $8 and really enjoy it. It'll be much healthier than at a vegan restaurant. So Gustavo, stay away from the vegan restaurants.
I never go to a vegan restaurant.
Yeah.
Oh.
And look for. I know where I know some of the places like at the Hyatt Hotel down there, the Grand Hyatt. right in their building used to be one of the most amazing taquerias where you get the most amazing beans. And there's another place called the Perla. They make tortillas that are that thick, just out of corn. Most amazing. Well, find yourself a Thai restaurant. There used to be even a vegan Chinese restaurant in there that I couldn't eat at because it was so darn full of oil. But find a Thai restaurant, a Chinese restaurant, a Japanese restaurant that'll make you the kind of food that we recommend: starch-based, not a load of oil all over it, and plenty of food. And that's how you can eat best in any big city. And San Francisco's as big a challenge as any. You certainly don't want to let your guard down just because the restaurant says vegan or vegetarian.
Yeah, no, I mean, really, the vegan restaurants, I think, are the worst. And I usually try to go to not stay in a hotel, to do an Airbnb or something like that, where I have a kitchen and have control of what I can make. But, sometimes you're out because you're tourist, you're visiting the city. So like you said, something Chinese, Japanese, where you can ask for steamed vegetables and a side rice. It's perfect. And also, I want to mention that, there's a restaurant, a fast food restaurant, I think you've mentioned, so that's before, so I'm going to mention it, Wendy's, where you can actually get a baked potato and a side salad for like $5. And it's something that it will get you by when you're in a situation where there's nothing else to eat. So, yeah, vegan restaurants are scary. Then, of course, a steakhouse, even though it doesn't sound right, but I mean, you can get a baked potato and a baked sweet potato and a side salad and have a perfect McDougall meal.
Yep, you can.
Yeah.
We've done that at times. That's been one of our fares, is a steakhouse, the baked potato. There's just nothing like a great whole bean burrito for me. That's what hits the spot. Or Mary never orders a tortilla shell.
Right.
She doesn't like the tortilla shell, and she's right, because they're usually, the wheat ones are loaded with vegetable oil, the corn ones are clean. But I guess I still like the burrito shells, but I try and get them clean.
We just have to be careful of how they make the beans. People need to make sure that they ask how they were cooked.
Oh, yeah, but usually if you ask, almost always if you ask for whole pinto beans, you'll do okay. You'll do good. I mean, they've got whole pinto beans there. Every Mexican restaurant starts in the morning.
Oh, yeah.
With a pot, water, and beans, and they were there once before they added the lard or the oil to them. So anyway, let's see what else is going on. Nothing politically.
Well, I just loved the last month's newsletter, Dr. McDougall. I think that if anybody here hasn't read it, I think that's a good one to print and have it there, because you have answered very many important questions there.
Well, thank you, Gustavo. I don't know if we talked about last month's newsletter or not, but yeah, I wrote it. I wrote this newsletter because of the questions that I'm going to follow with more questions, more personal McDougall nature this month. But the question is, again, we get you and I and Carol and Tiffany and Heather and, the whole staff, we get this question pretty much every day, is why should I believe you, McDougall? Why should I follow your diet, not the low carb or whatever, paleo or whatever that's so-and-so followed? Well, I gave you the reasons in that July 2017 newsletter. And I believe that anybody, I don't care what your degrees, what your background, what your current beliefs are, if you read the newsletter, read over the 4 things that happened to me. 4 of the things. There are lots of things that happened to me. But back in the 70s, you read about the 4 experiences I have. And you'll understand why I have come to the conclusion I've come to. And then as you read on in the newsletter, you'll see some other reasons you should listen to me Yeah, you should listen to me, not that low carb guru or that whatever. Yeah, and I gave you the reasons, not only because this is why I believe what I do, which was established more than 40 years ago, but this is who I am. I gave a fun Skype talk yesterday to a dancing school, dancers. These were teenage girls, probably, I would guess, just looking at them, and again, that's just a guess of age, but my guess is they were probably 15, 16, 14, 17-year-old girls. And I talked to them, to their dance class yesterday by Skype. And the teacher, we've known each other for a long time, but she contacted me afterwards and she said, that was just an amazing talk you gave to I don't know, she said the girls, and I should probably say the young women. But that was just an amazing talk you gave, because the talks I've heard you give in the past were professional, you as a doctor. And I could just see that going over the top of their heads, because you were talking about medical things and breast cancer and heart disease and rheumatoid arthritis and so on. She said, but I just applaud you, because what you did is you talked to these young girls as a grandfather. Yeah, that's what I did. I just put on my grandfather hat, and I told them I have 7 grandkids, and some of them are reaching your age, and these are the things that they're concerned about: pimples and body odor, and as dancers, you want to endure. And I was able to give them that kind of a communication. Getting back to the July 2017 newsletter. After you've had half a century of experience, which I had in medicine, 40 years of trying to get people to do the most difficult thing, which is to make the change, talking to all different audiences, having personally taken care of over 10,000 people, I think I have earned the right to ask you to let me help you, and to give me a chance, and to believe what I say, or at least give me a chance to see that there's some darn good reasons I believe what I believe. And by the way, we've published results on about 2,500 of our people. Just a whole bunch of reasons that if I was an outside consumer, if I was looking to solve my health problems, and I was bold enough to write Dr. McDougall and ask him why I should listen to him rather than X, Y, or Z dietitians, health club trainer, doctor, whatever. If you're bold enough to ask me that question, then you best read my July 2017 newsletter first, and then you ask me.
That's right.
But this month I'm going to answer some other questions, those that are past the point of why should I eat rice instead of roast beef.
That's right.
Some of them, by the way, Gustavo, some of them are people that are really asking for help. And Carol and I and the rest of the staff, we try and help. We try and give them some reasoning and rationale. We're always going to refer them to the July 2017 newsletter from now on, before we have any further discussion with them. But there are really a lot of people out there that are just, I can't find the right words to broadcast on my very professional high-end webinar.
That's
but
right.
They are. And they just want to give us a hard time and somehow prove that we're wrong and they're right, and they want to justify their ham sandwiches and bacon and eggs. And the best way for them to do it is to just come right to my face and say, McDougall, you're wrong. This person's right. But of course, they say it in some way that, enough. Follow whatever guru you want. I don't care. Enough.
You can just never have everybody agree with you. And, people want to eat what they want to eat, and that's how it is.
Yeah, that's how it is. Things are changing. Things are really changing. I'll talk to you about it as it develops.
Yeah.
There's an opportunity I may have in Europe. European folks, I get the impression, people from Europe, England particularly, Belgium, we have a lot of followers. And
You do have a lot of
a lot
followers
of followers in Europe. And I think most people who would think about the Europeans as healthy, they'd say, yes, they're trimmer, they're more active, they're more health conscious. And by the way, they all have universal healthcare systems. So they don't have to bend to the medical business and their pill pushing as much. But anyway, so I got a request from some of our followers. We have, fan clubs and so on in Europe. And they asked Mary and I to take a trip there soon and to present to some large health event. And they brought it up that, our country is a small country with lots of interest in good health and so on. And we are in a situation where we could change the whole country. And I said, fine, you set it up so that we, Mary and I, have an opportunity to change the whole country. Wouldn't it be something if a country came out and said,
oh, yeah,
the XYZ country are now all following a healthy diet and we've dropped our healthcare costs to virtually nothing.
Yes.
Anyway, so that is
Good.
coming up, and I'll tell you about it if it does develop and what it develops.
Dr. McDougall, I don't mean to cut you off, but are we okay with taking some questions? There's a lot of questions here. Yeah?
Because I have no place to go right now, actually.
Well, you always have a lot to say. No. It's not a problem.
Which is another thing we have to discuss before we quit today, what we're going to talk about over the next few weeks.
Well, I think, Dr. McDougall, we talked about once you used in the women's issues or the women's book, a lot of emails about that. That may be one of the topics for the next few weeks. I don't know.
Gustavo, you know what we did? We did a series about 12 months ago where I went through every chapter in the women's book and discussed it and gave people all the chapters in this book. What I was thinking of is updating the chapters and using that as topics, like what's happened in the last 30 years in osteoporosis therapy or heart surgery. What's happened in 30 years? What's happened in breast cancer treatment in 30 years? Because what people do is they look at me, they consider my age, they consider the age of my information, which, by the way, is as current as August 2017. And they say, well, what he wrote is old and outdated and irrelevant and so on. Believe me, ladies and gentlemen, it is not outdated. It is not old. It is not contradictory. The truth doesn't change. So I was thinking of maybe updating those chapters. But anyway, what kind of questions?
Okay. Let me start with one. I do have a couple of questions from the previous week's webinar about aluminum and water. But there's so many people right now, and actually by the email, asking about this issue that has come up again in the social media with different doctors, but especially Dr. Greger, that has been nonstop talking about arsenic in the rice, and people are stopping. They're not eating rice. They're scared. They don't know what kind of rice or how. If we really need to worry that much, would you just talk about this?
Yeah, I would like to. I think isn't it my April 2014 newsletter?
Right. I think we need to keep reminding people to put the name of that topic in your website.
You just go to the search engine.
Right. Because the search engine.
Or you just go to my website, look up search engine. Let's see if I can do that without losing this stuff. I'm taking this.
Yeah, that's okay. I mean, I eat rice once or twice a week. I don't think I'm going to die of arsenic poisoning. But I don't know. I mean, some other people, they like to eat rice every single day, and I don't know if that's an issue. But you can check on your website Remember, it's drmcdougall.com, everyone, and the search engine is.
I'm thinking rice is in my 2014 newsletter. It's my December 2014 newsletter, I believe.
Okay.
Okay, well, let's get back to you. What your question is. Arsenic and
Maybe
rice.
you can just give us a short answer, and people then can go and read that letter.
Well, I don't see. I haven't read what Gregor has put out on arsenic and rice, but I've heard a lot about it. People have written me emails. They're afraid to eat rice, and I understand Dr. Gregor, who, by the way, is very much on our team and a very, very good friend. That Dr. Gregor has done a whole bunch of, or maybe one or two, I don't know how many, of his nutritionfacts.org on the arsenic and rice, and it's to the point where people are afraid to eat rice. That's what it comes down to. Well, I've actually asked Dr. Gregor to debate with me publicly a few topics that he and I disagree on in a friendly way. So far, I've not gotten acceptance, but the invitation is open and it's always friendly. The issue of the arsenic in rice was brought out by Consumers Reports back probably in 2013. Big deal. You know, they don't eat rice. Brown rice is worse because the arsenic is concentrated in the shell of the rice. So what your options are is to wash the rice, eat wet rice, mostly don't eat rice. Well, in a previous issue of Consumers Reports, not just but a few months earlier, they pointed out that vegetables and juices have more arsenic than does rice. Anyway, there's arsenic every place in the environment. It's all over the environment. And the greatest concentration of arsenic in our entire environment comes from seafood, 90% of the arsenic. It's an organic form, but it's still toxic. They say it's okay to eat seafood because it's organic arsenic. Well, I gave you the concern about that in that newsletter. The reason there's arsenic in rice is high concentrations is number one, and most important, is rice is grown in polluted soils. Number two is rice is a hyperaccumulator of arsenic and other metals. It very efficiently accumulates metals out of the soil. Well, you know, I don't know in relative value, but I'll tell you some real hyperaccumulators of toxic substances are things like broccoli and kale, which hyperaccumulate cesium and all kinds of other toxic substances. So hyperaccumulation is not an unnatural thing. That's part of the plant's physiology. It wasn't a mistake of nature. And it's not a reason to stop eating rice, but it is a reason. Any foods, juices, vegetables, any foods. You need to eat foods that are grown in clean soils. Let's go back to rice. For example, rice found in California has about half the arsenic as rice that you buy that was grown in Louisiana. And the difference is, in Louisiana, a few decades back, the fields that they now grow rice in, they grew cotton in. And the cotton was infected with boll weevils. And the way they killed the boll weevils is they put arsenic all over the cotton plants. And so it got in the soil. And that's why you have such concentration in certain parts of the world, because they used to use that soil to grow things with the use of pollutants such as arsenic. So you kind of look around for rice sources that are lowest in arsenic. You don't want to be eating arsenic. I mean, please don't get me wrong. Arsenic is it's the king of poisons, but it's impossible to avoid completely. But and you want to eat as reasonably low levels as possible. What I point out in this newsletter that I wrote is that we're getting hyper about rice, and this is a serious distraction to what we should be concerned about. We're getting hyper about rice. As a result, people are avoiding rice, and that means you can't be on a starch-based diet, they think. What are you going to eat? Especially people who are on gluten-free diets. Rice is often one of their most important staples. What are they going to eat? They're going to have to go back to chicken and fish and beef and pork. Oh, excuse me. Chicken, fish, beef, and pork, their food are things that are loaded with arsenic and other heavy metals. Soybeans and corn and so on. And where do you think those heavy metals go after they eat them? So switching to animal foods just for the pollution issue is 100% wrong. Animal foods have the highest level of pollutants, organic and inorganic pollutants of any foods, because they're highest on the food chain. So that's not a choice. Well, what do you do? What do you do? So you're afraid of rice. Dr. Greger has added to this phobia. Not totally inappropriate. He's right. You're not supposed to be eating rice and arsenic. You should find minimal levels. But to the point of a hysteria among my patients, which is not good for them or planet Earth. Okay, just to say, let's put more value into Dr. Greger's concern than I have. I don't concern. I wrote a whole newsletter on it. Well, what do you do? First of all, I told you to find cleaner sources of rice and other foods. And second of all, you don't have to eat rice on the McDougall diet. You could eat potatoes, sweet potatoes, corn, wheat. There are all kinds of starches you can pick. It's not a problem. So there's no contradiction with following a starch-based healthy diet if you're going to avoid rice with the arsenic that's in it. Well, let's see. I guess that would be the easiest answers. Find cleaner rice. Don't eat rice. Eat other starches. But what I wanted to point out, and where I'm getting at, is this hysteria. And I'm going to stop here. Promise, Gustavo. I'm going to stop here. The hysteria that's been created to cause people to fear rice and instead switch to all they know to eat otherwise, which is junk, meat, cheese, etc., which are much more highly contaminated, poisonous. And the other thing that I want to point out for those of you who want to put it in a worldwide perspective is in the last 35 years, diseases of overnutrition have replaced diseases of undernutrition. And the countries that are notable rice eaters, like China, Thailand, Vietnam, and so on, they have become ridden in the last 30 years with Western diseases. As they've decreased their rice intake, they have developed epidemic obesity, diabetes, heart disease, and they decreased their rice intake. That's what they did over 30 years. But they also, more importantly, but in the same perspective, they also doubled their animal food intake and doubled their oil intake in those same years. So the World Health Organization reports that these typical American diseases, heart disease, obesity, diabetes, and so on, they are now worldwide, world-threatening, rapidly growing epidemics in underdeveloped countries, and including huge rice eaters. Like in China, 90% of their diet was rice. 90% of their diet was rice 35 years ago. 35 years ago, there was no type 2 diabetes in China or obesity, pretty much none. So anyway, I think it all needs to be put in perspective, and I that's probably as clear as I can be.
That's so right when you talk about perspective and the phobia that the media can create now, because it's so easy to disseminate information nowadays with the social media, and it's so easy to create panic and phobia and keep a perspective, like you're saying. Do you think it would matter at all if a person washes the rice a couple of maybe 3 times just before cooking?
Well, it's not going to eliminate the problem.
Okay.
The rice is incorporated in The arsenic's incorporated in the structure of the rice. That's what they recommended, is to wash the rice and eat white rice. But those are not going to solve the problem.
Right.
You're still going to get a high level of arsenic intake. And as I mentioned, the same Consumer Report magazine condemned vegetables and fruit juices as having more arsenic than does rice in previous issues, previous magazine issues. Yeah, I think you need to put it in perspective. I think you need to put the whole thing in perspective, because one little fact, alternative fact or real truth fact, one little fact can make you decide to not do the right thing, you and I. Any excuse so we don't have to change our bad habits. Oh, there's arsenic in rice. I better stick with my pork chops. It's just human nature. Yeah. Oh, it's good to eat chocolate. It has antioxidants in it, so I'm going. It's just the way we are. Any article that says it's good to drink alcohol, great, reaches many pleased readers. They want to hear this. Wine increases your risk of dying of heart disease. Well, it also killed your brother's wife's wife at age 32, and alcohol did, and it's ruining your marriage, and but it reduces your risk of heart disease, by the way, which it doesn't.
Right.
So these things like Gregory's exaggeration, and really, Michael, you and I are friends, and if you want to talk about this, I'm happy to. I think you need more perspective to your listening audience, so that you don't cause them to start thinking about things that are less important than eating a starch-based diet, going for a walk, and getting some sunshine. Pretty simple.
All right, Dr. McDougall. I think that's.
I wonder if I can do a nutritionsfacts.org video on my point of view on it. I would certainly invite. I won't need to pick on Michael, because we're good friends. But there are about 5 or 6 different things that he and I have a different perspective on. And again, I told him this would make great public interest for us to discuss these 5 issues publicly, and it would be a very friendly discussion. And both of us have perspectives that need to be looked at, and see where we want to lay our path in life. Who do we want to listen to? Nothing's going to hurt you with more information, but I think you need. I think you need to put things in true perspective instead of getting carried away under hysterical facts. Right.
Hysterical facts. That's right. That's another name that you just came up with.
I can do a whole newsletter on hysteria producing facts.
That's right.
Like vitamin D deficiency and arsenic in rice and what do you need to?
And not getting enough sunlight.
Oh God, I tell you, I have a. Yeah, it would be a fun discussion. But
okay,
for those of you who are interested on my point of view about these topics, whether it be vitamin D or arsenic in rice, all you have to do is go to www.drmcdougall.com and look at the search feature and type in rice or arsenic or vitamin D, and you'll see I've written.
Yes.
Well, let's just say I've written a lot of stuff. Whether it's true or not, you'll have to decide to believe it. But I do give you the scientific references.
You do.
And I do give you why I've come to this conclusion. And certainly everybody, well, it seems like there are lots of opinions out there in the world, but isn't it an exciting time to live in?
It is.
All the things politically that are going on. And, we started out with, well, anyway, it's just, I can hardly wait to turn on the news every day to see what kind of foolishness went on today.
Okay, well, you and I then, it's like I do not turn the news at all. So I'm glad that you do. Maybe you can tell me what's going on. It's painful. I just can't do it. Okay, Dr. McDougall, let's do a couple of questions about the last webinar where you talked about Alzheimer, and there's someone that said that this person watched both of our webinars on the aluminum Alzheimer, and then this person says, should I not use canned tomatoes and beans, or are the cans all made of steel? I see on your list of recommended foods that you do not have canned foods, so I just want to confirm.
Well, these days, most canned foods are put in steel casings, not aluminum anymore. And if they do use metal, people who do canning, they will put a shellac coat on the inside to protect you from the leaking metal. That's common practice, but certainly, I mean, if you drink sodas, 7-Up, Coca-Cola, etc., those are aluminum cans. Beer too; these are aluminum, and the aluminum ends up in the liquid. And you can actually, if you're interested, you can actually find out which soda pop has more aluminum than the other. It's unimportant. It's, yes, cans and containers, they will leak aluminum out into your food. So you need to avoid aluminum pots and pans and cans and utensils and so on. We do. We have for over 30 years. We don't use any aluminum cookware at our clinic. It's most out of principle, and people have been eating aluminum for 6 decades, and for those 10 days you get aluminum-free food. So.
All right, but well, of course, then the hyperlinks that you put on your newsletters are what people really want to click on, because that's when they can see the actual research that you provide us with that other doctors don't.
I either provide the actual paper, which I do in most cases, or I provide the best reference I can considering copyright issues. So, yeah, you need aluminum. Excuse me. For those of you who haven't read it, so my May or June newsletter. Alzheimer's. We know the cause of Alzheimer's disease. It's aluminum poisoning.
Yeah, it is a known fact now. Dr. McDougall, one more question about water. I heard that drinking distilled water pulls out unwanted toxins from the body, this person says. Would that be an alternative to drinking silicone-rich water like Fiji water for aluminum toxicity? Thanks so much for the time you spent with us live, everyone.
Distilled water, it's pure H2O. And it doesn't have minerals, et cetera, or poisons. It's not supposed to have anything like that in it. And so you're not adding any of these toxins, but it doesn't have the special ingredient of silicon, which will actually form a complex with the aluminum ions in your body and allow them to be removed through the kidney system. So it's the silicon that you're looking for. What do you got there, Mary? Okay, most broths, tomatoes, beans, etc., are also sold in boxes. Go ahead, Cheryl. Well, come on in here.
Hello, everyone. I just want you to know that most of the things that you're concerned about that are canned products, they're also sold in these kind of boxes. Beans, tomatoes, and these are metal-free, and you can buy them all over. So you can buy soups this way. You can buy broths this way. So if you're concerned about cans, look for packages that are paper.
There you go.
Right.
Now you know. Now you know. Mary knows all these things. I know about.
You enjoy the food that she makes. That's what happens.
This is definitely a partnership. Without the two
Yeah.
working together, we'd be in big trouble.
Right. Very good.
But let me get back to the silicon thing.
Okay. All right.
The silicon, people asked me after I wrote the newsletter, and I listed in there some references, and we talked about this in the last newsletter. I showed you a couple of examples of silicon bottled water. In the last webinar, we talked about this. And even since then, people have written me and said, well, can I use silicon powders? Can I use this other waters and things like that? Well, I'm not going to give you any more information because basically I don't have it. And the other thing is I don't recommend supplements just in general, and silicon water would be a supplement. So I'm not going to tell you about other forms of silicon. I'm not going to tell you recommend any silicon waters or silicon supplements or anything like that. I gave you the reference to the British researcher, and I in that article talks about a couple of mineral waters that have high silicon content, which provides silicon to the body to complex the aluminum ions to help remove them from the body, and they've reported some positive results. So folks, take that information and read further on the internet about silicon waters. I wouldn't even have mentioned if I didn't think there was some truth to it. And no toxicity and virtually no added expense. But that's as far as I can go as far as what to add.
It's silicon. Fair.
Do I drink silicon water? Not yet. I certainly wouldn't discount it as a new behavior in our lives. I drink a lot of water, so for myself personally, I would have no hesitation to do it, but I haven't, and I do rely heavily upon avoiding all aluminum contact that I can.
Right. All right. Very good. Thank you. Let's do one more question, and we'll finish here for today. And I want to let everybody know that I will keep your questions that we haven't covered, and we will continue next week, hopefully.
In person.
In person.
That's
right.
We got to find some beautiful, picturesque spot next Thursday, someplace at our clinic in Santa Rosa to show off what a nice setting we have, but not too distracting.
That's right.
And we get to sit together and
all
do
right.
the next
well, that'll be my job, to find the right spot then.
So you've been to our resort so many times.
Yeah.
Backwards and forwards. You have to come to work. You're not allowed to come and play.
Oh, no, not this time. This time I want to work. One more thing about questions I want to ask from people is that when they send a question, if they could write the question as concisely as possible, because we get sometimes questions that are a full page, and it makes it really difficult for me to read a 10-minute long question. So please, if you could be as concise as possible, that would help out.
Yeah.
Dr. McDougall, one more question that sounds interesting, and we can go is, a person says, if you could go back in time, knowing then what you know now, primarily with the backlash from the mainstream food industries, meat, dairy, etc., would you have done anything differently?
Well, right or wrong, I live my life as if it has some purpose and some guidance. So I don't know that I was that much of a decision maker in what happened, and I really can't think of anything I would change. I was fortunate enough to get the best partner in the world to live with for the last 45 years. I was fortunate enough to go to a decent medical school and a good residency. And if you read that newsletter from, I guess, last month, yeah, about why I believe what I believe, I had some experiences that were very. I don't think I'd change anything. I know what I would do. I'd save some more money because I should be retiring. That's what I would have done. I would have put the money away because I didn't. I have to love what I do, but I can't stop working, folks. I still have to keep working. So I'd have put more money away. I'd have been a better investor.
Well, you have written 12 best-selling books.
13.
That's 12 or 13 now.
Yeah, I do think if I had a different personality, one like Dr. Gregor's or Neil Bernard's or Esselstyn's, or if I had a different personality and a different focuses, I'd have probably done things like been more politically active and spent time in Sacramento, getting more laws passed, and I would have. I don't know. I think life's been really good to me, actually.
Yes, I agree. Well, I think that the way you have spent the time giving out information is really the best. Passing laws doesn't mean that the laws will be enforced, so I don't know.
Well, it hasn't been, but
right, they hasn't.
We got a law passed on breast cancer treatments. I did. A law passed on educating doctors on good nutrition. And it didn't seem to make any difference. So it's certainly a course that we need to take. The government needs to be involved in serving the public.
Yeah.
I don't know, Gustavo and everybody else listening.
Yeah.
When you talk to me, you're going to find somebody that has very, very few complaints in life. I've been blessed, no question about it. And
yeah. It's been a wonderful life, and we hope that there will be many, many more years to come. So,
hey, wait a minute. That's up for discussion too. We could do a whole webinar on how long and how I want to live the next 15, 20 years.
That's right. That will be a really good webinar. Okay, someone else is asking me. Yes. The questions that you have emailed that were not answered today, I will have them for Dr. McDougall next week. Don't worry, we'll cover them.
As far as writing things to us, unfortunately or fortunately, we answer all your emails, and this requires 3 staff members of mine to read your emails and try and get you decent answers. I mean, I pay 3 people to do this. So be kind to us in terms of being succinct in the questions. And also, before you even ask, please go to my website, use the search engine, type in your question.
Well, yeah, because they can get it. Right. They can save some time.
And then write us, and we will answer you. That's the problem. Right. We will answer you.
And actually, if they do that, they might be able to write a more concise answer, a question, once they have read what you said, to be even more productive.
More relevant. Okay, so there's arsenic in rice. You answered all my questions, but there's one more thing I'd like to know. Well, okay, I'll try and answer that one more thing.
Yeah.
But give us an opportunity to expose you to previous efforts that we've done and previous information that I put together in writings and Mary's put together. And do that for us first and answer your question.
Very good. Well, Dr. McDougall, I'm going to go on and continue to enjoy this wonderful weather here in San Francisco. And I'll see you tomorrow, and then we'll do our webinar together next week.
We'll look forward to tomorrow. Alcatraz, by the way, is my favorite place to go in San Francisco.
It is an
It's
amazing
amazing.
city. I love it. I love it. Yes.
Well, thank you.
Okay.
Thank you, Gustavo, for taking time out of your vacation, your family, and letting this happen today. Okay, really appreciate it. See you tomorrow.
All right. See you tomorrow. Okay. Bye-bye.